Good afternoon or good morning to you, depending on where you are in the country. Thank you for joining us today. My name is Jose Leon. I am the Chief Medical Officer at the National Center for Health in Public Housing. Thank you so much for attending this webinar series. This is the second session that we are discussing the post-COVID-19 pandemic issues and strategies. Today, we are going to discuss a little bit about the workforce issues and some challenges and solutions. Just a reminder, this activity is not only a webinar, but a Facebook Live. So if you are unable to join us on Zoom, you can also go to our website, to our Facebook page, the National Center for Health and Public Housing, and you can comment, add whatever you need to add on either Zoom or Facebook, and we are going to be checking both just to discuss a little bit about the workforce issues that everybody is facing or we are going to face in the future. This at the same time, this activity is, since this is a Zoom/Facebook Live activity, is more like interactive activity. So anything that you would like to add or comment, please make sure that you participate in the discussion. It is always nice to hear from other health centers about challenges, solutions, promising practices. So at this moment, everybody is muted. If you would like to turn your camera on, please do so, and please feel free to do it. Again, if you would like to participate, you can use the chat and type your question at any time. If you would like to participate verbally, you can also use the you can also raise your hand, and your mic will be unmuted. The webinar is being recorded, and all the materials that we're going to discuss today will be sent to everyone and all participants via email shortly. Just a quick reminder, we are the National Center for Health and Public Housing. We provide training and technical assistance to community health centers. We focus on health centers located in or immediately accessible to public housing. And our training activities are live webinars. We also have learning collaboratives, publications like monographs and training manuals. You can also go to our websites and see our interactive maps. Specifically, if you are interested in having collaborations with any of the community organizations, or especially with your public housing agency, you can find their contact information and everything that you need to know on how to collaborate with these organizations. And again, we are funded by HRSA to provide training and technical assistance to community health centers. This is just a recap of what we discussed a few days ago. We had, and we are very pleased to have again, our panelist Sarah Marcellian, and she provided an overview of La Maestra community health centers, and she listed some lessons learned from a historical perspective. We examined what La Maestra Health Center has done to adapt to the endemic COVID-19 era. We discussed the future of virtual and on-site visit for La Maestra, and Zara listed the strategies to maintain and improve primary health services. Today, we are going to discuss a very important topic, which is workforce issues. Again, Zara will quickly provide an overview of La Maestra in case you are not familiar with La Maestra community health centers, and we are planning to discuss the pandemic's impact on the health center workforce. We're going to list some strategies for supporting a healthy and resilient workforce, and we are going to examine workforce planning for a rapidly changing primary care system. there are 435 health centers providing services to public housing residents and those living in or immediately accessible to public housing. In 2020, they served 5.1 million. 100 of these 435 health centers are public housing primary care grantees. And in 2020, they provided services to over 850,000 patients. Public housing is a really interesting special population, because within public housing you can find some vulnerable and special populations as well. 30% of the household report to have a person who is over the age of 65. 38% of the households also report to have at least one person with a disability. 95% of those living in public housing are low income, and 55% of them have less than a high school diploma. Another data or another percentage that is important is that 37% of them are children. So it's if you are providing services to this particular population, specifically now that some of the children are behind their vaccines, this is a population that we also need to focus on, and making sure that we are addressing all the clinical needs and primary care needs of this special population. So before we get started, I would like to introduce our speaker for today's activity. We are happy to have Zara again. Zara Marcellian is the president of Zara Marcellian Consulting. She provides technical assistance through monographs, webinars, and consultation for health center programs, grantees, and other nonprofit service providers nationwide on various topics that affect the health of cultural, diverse, low-income public housing residents, older adults, and other special populations. So Zara is also the founder, president, and chief executive officer of La Maestra Family Clinic, a nonprofit federally qualified health center that serves almost 49,000 underserved individuals every year across some of the lowest income and diverse region of San Diego County, California. For the past 20 years, La Maestra has been dedicated to improving access and quality by providing primary and especially healthcare, as well as an on-site upstream social services for all individuals, regardless of their ability to pay. Dr. Marcellian received a PhD in leadership studies from the University of San Diego, and she holds a Master of Arts in Organizational Development from the Phoenix University, and a BA in Sociology with a minor in Psychology from San Diego State University. Thank you, Zara, for being with us.
Thank you so much, Jose, for inviting me. This is another great opportunity to share some of our experience at La Maestra and looking towards the future trends and preparing for some of those challenges moving forward. So I like the opportunity to share at least our experience.
Thank you, Zara. Just before we get started and discuss our agenda for today's webinar, these are some challenges reported by health centers through the COVID-19 survey. Most of the challenges right now are related to staff, the number of staff members to administer vaccines, and some issues with financial reimbursement for costs associated with vaccine administration, as well as vaccine confidence. So this is what is happening now, and we are moving. Hopefully, we are going out of this pandemic, and it's not that COVID will disappear, but somehow it's going to become an endemic disease, as any other of the infectious diseases that we have, like the flu or other of the vaccine preventable diseases. So Sarah, before we get started, for those who are not familiar with La Maestra, can you just provide an overview of La Maestra Community Health Center?
Sure. Thank you. La Maestra was formed in 1986, actually, as an educational nonprofit grassroots organization in San Diego to help people that were applying for the amnesty program. And we were all English language teachers and assisted people who were qualified to apply for permanent residency, phase 1, phase 2, and then on to citizenship much later. Well, of these 12,000 students, we quickly realized that they needed health services. We had a student council and they said, we need health care here in our community, in a place where we feel like we're accepted, that there are other cultures, that mirror our belief systems and, our traditions and our languages. And so that's how we started La Maestra Family Clinic in 1990. And here we are today, about 245,000 patient visits a year with 45,000 unduplicated patients. And aside from the comprehensive healthcare services that we've provided, and I invite everybody to visit our website, it's lamaestra.org. We have grown along with the clinic, our social determinants programs. Back then we didn't call them that, we call them survival services, around housing assistance. We had a food pantry, immigration services, economic development programs, because we know that poverty really drives a lot of these, layered challenges that our populations experience, aside from many, come from previous very traumatic backgrounds. So if you layer that with, inability to find affordable housing or, the food scarcity issues, not knowing if they're going to be able to find a job that is going to support themselves and their family, all of these are really, these challenges impact the health and well-being of our patients. And so we've grown these services along with, the clinical services, with the medical, mental health, dental, behavioral health, all integrated. So this circle of care is an integrated, holistic model. And our, more and more we see how one aspect of somebody's well-being could be, their medical effects, how they're going to be able to do in the workforce and how long are they going to be able to keep that job, and vice versa. If there's somebody coming in with needs, let's say they're human trafficking assistance, unless they get that other complementary mental health services, job training, housing, their progress towards healing is going to be, taking a lot longer. So those are just some examples, Jose, and we have about 750 employees currently, full-time employees. We're looking forward to many more innovative programs and strategies in the future to kind of deal with some of the trends that we see coming up.
Thank you, Zara. Just a follow-up question. How the COVID-19 pandemic affected the Maestra workforce? When we started, and we know that we have a lot of, at the beginning, furloughs was a big issue, a burnout. So what do you see, when we started all these COVID-19 pandemic issues?
Sure. Well, at the beginning of the pandemic, of course, everybody was, very uncertain, and kind of we still are, about, how long this epidemic was going to last, how many people would be affected, how many, of our workforce would be at home, like, how are we going to cover certain clinic sites? We have like 17 sites, including our school-based sites and our, mobile licensed clinics and so forth, aside from our, flagship sites in City Heights and in most of San Diego County. We have a lot of partners as well, so we kind of collaborate around programs in other geographic areas. So not knowing, was this big uncertainty. And of course, everybody, their first focus was, how do we keep our staff safe? How do we keep our patients safe? And our team was absolutely amazing, so flexible and willing to be there on the front lines during this, uncertainty of the epidemic, and making sure that their colleagues were safe. And it was great. I mean, we started this task force, and it's still in effect now regarding COVID. How the logistics, how do we set up screening, areas, and are we going to get enough PPE, to protect our workforce? And what about the air filtration systems in our dentals, and the plexiglass and the social distancing, and and always there was so much change. And I think that's a characteristic that most health centers excel in, is the ability to pivot, to change, to be, responsive immediately to emergency situations, and to not just, be present, but think of new ways to address, the way that we had to change our workflow, for example, drive-through testing, and just a myriad of other very complicated, quick issues to deal with. So our workforce was, number one at responding to this epidemic, and also focusing on community needs, and how were we going to keep those access points open, or open new ones, right, for our community and members of the community, perhaps, that were, really worried about coming in person. And, we stepped up our telemedicine, did the virtual visits, had the kiosks for people that, weren't able to have a confidential space in their home to talk about very sensitive issues, right? So they could come into the clinic. We had all of the hardware there, and we still do, for people to come in. It's a small kiosk area, very confidential, so they can conduct their visits with maybe counseling, mental health, behavioral health, and so forth in in privacy. So that all of those very creative strategies were born immediately by, from this pressure, right, from the epidemic arriving, and then basically being able to cover, some staff that were out, they were ill, or they were attending to family members that were ill, making the leadership at La Maestra and the board so, I think, compassionate in their response to how can they accommodate the staff, the needs, like childcare issues. Schools were not in-person learning for quite some time, which meant our employees had all of a sudden the difficulty of figuring out how to monitor their child or their children at home, and help them with their schoolwork at home, and yet still work. So converting a lot of our admin, referrals, call center from home, right? So, and then we began to do some hybrid hours, and still be very flexible with people, so they could continue to work. And but it was always a concern, as we would see the numbers of COVID tick up, and then see the corresponding number of our employees that were also ill, and trying to cover those positions. I think we were able to do that because many of our staff are cross-trained, and that brings that extra strength to our organization, and not having to shut down any of our sites. That was a real blessing.
Thank you, Zara. There have been different studies on the impact of the pandemic on the workforce, specifically on clinical staff. And this is a list of issues affecting, or issues that affected our clinical staff during the pandemic. This is a study I was reading from one of the research publications on the National Library of Medicine. And basically, these are the most common issues, like the physical health, safety, and security. Some clinicians were not only concerned about themselves, but their relatives. In the beginning, will I, take the virus with me to a family member? I also have, they thought about their children, or some of them may had a relative with an immunocompromised system, or with receiving cancer treatment. The other issue was the workload. Everybody was working hard, every time. Stigma was another one. In the beginning, nobody wanted to be close to a clinician or someone working in a healthcare facility. Then the ethical, the moral, and professional dilemmas, like what can I do? Can I go beyond what I'm doing? I was trained to be a clinician or a nurse, so all others were impacted by professional growth. Everybody was just focusing on COVID, and how they could provide support, or how they could get support to and from others was another thing that was mentioned in this study. But there is something that is not listed here, and it's all the behavioral health issues, I guess, affecting our workforce. Did you have a program or anything to help the mental health status of your workforce during the pandemic?
Absolutely. Thank you for asking that question. We have a wellness center that is an integrated, again, another integrated model within the bigger circle of care. And what it does is it blends the medical needs, mental health needs, and screens for behavioral health needs. And we also have a full, medication-assisted treatment program, counseling, and it's very well-rounded. So we thought right away, let's open this up for our employees, regardless of, who's going to pay for it, whatever. We wanted to support our employees, number one, however we could. We wanted them to feel supported, because we all know that when we're dealing with uncertainties, a supportive network means everything. And not just for the staff, but for the community as well. That's why, our patients would constantly be in contact, what's going on? What should I do? I'm worried about this. Where do I find out, information or resources? And that's what a supportive network offers, is that connectivity and social connectedness and resources. And so that was also much needed by our employees and our workforce, because, as you mentioned, a lot of these different scenarios did happen. People were sick, their family members sick. People were afraid that they would carry the virus to, their loved ones, and just in general, like how long was this going to go on, and how long were they going to not be able to, you know, like interact with their loved ones at the same level, especially around the holidays. I mean, that was really tough for people. But I have to say that we did experience a lot of growth during COVID. You know, we did have, of course, you know, people out on furlough, staff getting sick or taking care of family members who were sick. But again, that cross training and being able to bring in more, you know, workforce, that was very helpful. But I would say that, you know, if we look at NACHC study, National Association of Community Health Centers, we see that there's an article there on their website that refers to, I think they did a survey, out of 68% of health centers nationwide, there was the reported attrition in their workforce was 25%. I mean, that's really substantial. And of course, you know, there's differences between, you know, urban and rural, and it just, but overall, the healthcare sector, I think, you know, has really been hit hard because of the expectations and the response, the level of responsibility healthcare workers have taken on during this epidemic is really incredible. And those sacrificing, you know, yourself and your time and putting people in your family at risk and so forth. So I really commend them. So what we did is we supported them through these services that we made available, counseling, dealing with stress, depression, feeling like you're isolated, feeling like you're getting burned out. Those were, you know, services that we offered through our wellness center, which I've just described, to our staff for free. And also we had some support groups. Our wellness center also led some and still does some meditation, weekly meditations online. And then in our other programs that were non-clinical, like human trafficking assistance, domestic violence, our microcredit programs, they all rapidly, you know, were able to form something online and invite the group so that they had that support. Also, our youth development unit started their own, you know, virtual classroom, virtual, you know, conversations, support, again, support. So they stayed connected, and that's how we were able to know, okay, what are they struggling with now? What are they feeling now? And like, for example, our youth development unit, they had, I want to say 33% reported the need to speak with a counselor because they wanted to know how to cope through this pandemic and they didn't know what was going to happen. And that feeling of helplessness, again, is really scary. So that kind of carried through this need to do the support groups, the virtual talking circles, meditation for our staff as well as patients. That really carried through all of the programs in terms of a huge need. And I think it helped us combat what everybody was feeling, right?
Correct. Thank you, Zara. That was very useful and very insightful. So moving on, we have another topic as part of the agenda about list strategies for supporting a healthy and resilient workforce. And you have already mentioned some of the things that, you know, or promising practices that you are doing. But I am not planning to read all these strategies. But this was something from the another study that I found on what other organizations are doing, you know, to
right.
to improve resiliency. So is there anything, that you talk about coping, with the pandemic and the need to have these social support groups and making sure that everybody who was experiencing an issue during COVID had that issue addressed. The question, Zara, is in regards to the non-clinical staff. They also were impacted by the pandemic, and you and I have discussed about your liaison workforce at your CHWs. So what was the impact on this particular group? Not only because they didn't have in the beginning, the ability to go to the communities because people were afraid of being in contact, with others, but at the same time, they also were affected by people they knew who got infected, or unfortunate people they knew who died, either relatives or friends. So what do you see? What issues affected your non-clinical staff, and specifically your CHWs?
Well, thank you for that, asking that question. Our community health workers, we have different names for them, different titles, because we have at La Maestra, we've always been very culturally diverse. We have about 30 plus languages spoken in our facility every day in our facilities. So we hire from within the communities that we work with. And so that's why we have this rich representation, and we call them medically trained cultural liaisons. They do more than, translating, interpreting. They educate staff, providers, support staff about their culture and their traditions and their beliefs, and helps everybody understand then how to tailor the messages of health education, outreach, and even, as we know, our cultures do impact the way that we receive treatment and how open we are and how compliant we are with, referrals, follow-ups, and so forth. So our community health workers, including our cultural liaisons, promotoras, navigators, peer support, they all became so pivotal here in this scenario where you have to do so much case management and you have so many more interactions with the patients during an epidemic, not just about their treatment, but about questions that they have. And you understand, because you are one of those populations, right, that are facing the same issues, that have had the same shared life experiences. And that means everything to our diverse patient population. If they can right away identify and build trust because they have somebody working with them who really is of their same background and culture and shared beliefs and experiences in life, right? So they have been extremely essential to not just, making sure that we keep track of the patients, opening access points in the community and through, virtual modalities, as well as following up with people and being there and being their contact point. So thank you for bringing that up, because without them, we really would not have been able to also impart the latest information about the vaccine or about the testing, about the protocol, and what does this mean, and what's the differences between the vaccine and how safe is it, and dealing with some of these real opposition to the vaccines. And it was really with all of their help that we were able to formulate the message and be as impactful as we could in terms of rolling out the vaccines.
Thank you. There is Yeah, I've been talking to some of the health centers about the what's next. You know, I mean, unfortunately, we live in a world that is rapidly changing, and nobody can guarantee that we are not going to have another pandemic
Right.
or another natural disaster or man-made disaster. I mean, we live in this world. We know that right now we have a war, you know, and
Yes.
we are having people, you know, coming to the United States with mental health issues from all these uh, conflict areas. So, do you have a plan in place to make sure that you have um, your workforce secure, you know, that you are securing that they are resilient, that they are adapting, that they are, you know, I mean, ready for. I hope that this is not going to be the case, you know, for the next emergency.
Yeah, you're right. You know, the first thing we did was during COVID and continuing on, looking at the pay rates and our, you know, and adjusting our staff, their, you know, their hourly rate, their salaries, to remain competitive. Retention is huge. And so we want to be able to retain our staff and add to that, right? So the board, you know, was wonderful. They approved for us to use a lot of our provider relief funds to support our staff and work towards the retention. And so we did the adjustments in pay. We also gave out bonuses. We increased the days of holiday pay as well. We supported 100% a transportation program for our employees that relied on public transportation. And as we know, you know, during, you know, the first part of COVID, nobody, you know, everybody was said, you know, well, you shouldn't take public transportation, you know. So we right away employed this, you know, transportation benefit as well. Aside from doing what we could to help people, you know, cope and stay with us, right? Cope with the current situation and lack of food and lack of transportation and so forth. You know, we help them get their, you know, if they were virtual, they were remote employees. And then when it became hybrid, we helped with all of the equipment that they needed, the connectivity, the IT support, which was incredible. If you figure 750 employees right away, you know, what do you do? Making sure that, you know, that they have what they need to be able to connect and all of the problems that, you know, that go on, technical issues. And so that was incredible. We have a very strong IT staff. And also we have a talent management program that we started through our human resources unit in conjunction with our management team, I would say about a year or two before COVID. So that really did help us, because what we do through this talent management program, again, it's based on retention, focuses on retention, helping to identify with each employee what their future goals are and how we as an organization can support that. Can we be, you know, more flexible with the hours they need, perhaps to go to class, if they want to pursue, you know, more advanced education? Do they want to pursue certifications? Is this some training that we can bring into La Maestra to provide more on the job training and help people then realize their career goals? And for them to know that when they do that, they still have a home at La Maestra. We want them. We want them to grow along with the organization. So that's really, I think, taken a strong, you know, it's been energized. That whole talent management program has been energized. And we continue to add to that and that constant, communication with the employees. And we're going to do more of that, moving forward. Just helps people feel like they do have the support from their employer on what they have as goals, career goals for themselves. And hopefully there's a match in the future and they can stay with us. And they don't need to go somewhere else to look for that same kind of encouragement and appreciation. Really, we really do appreciate, and also the feeling that, again, they have that support, that belonging. They work with others that are similar, and again, in their background, and so they have more of a family feeling rather than a corporate, more sterile environment to work in. And, we, of course, as all health centers, face the threat of these larger healthcare institutions of hospitals always being able to offer a lot more pay and losing, some of the workforce to the hospitals, especially the nursing staff and, the lab staff and so forth. So I think that the more we can do to support our workforce, to retain them, to encourage them in their future endeavors, and stay with our organization, bringing those resources they've learned into their skills into our organization, we'll all continue to grow together.
Yep, thank you so much, Zara. Now, this is we are trying to get out of the pandemic, and then we are going to talk about the future of primary care workforce. And the non-clinical positions are going to be crucial, to support the whole patient. Just to, there are some strategies on reassess capabilities and roles, and cultivate strong leaders, and promote diversity, equity, and inclusion, and invest in today to prepare for tomorrow. So, what is La Maestra strategy? I mean, we've been talking about recruiting from the community. We already talked about the CHWs or promoters and promotoras, but I mean, in addition to try to retain the clinical staff, what is the strategy to work, and retain all the non-clinical positions, making sure that everybody, that they don't feel that they are in a corporate, as you mentioned, or in a corporation, that they are just a number, but they are just more like a family in the community, as part of the health center. What is the strategy for the non-clinical positions?
And we found with the non-clinical positions that the best way to, I think, gain understanding for, the counter units, let's say, front office, back office, referrals, call center, and so forth, is if employees that are supporting clinical positions and services, if they have an opportunity to be cross-trained, it really builds an incredible amount of understanding of what their colleagues are going through, and it mitigates these divisions between units, and it encourages more of a unified, integrated feeling, moving forward, and really working as a whole rather than these individual units working independently, and the patient can really feel that, if everybody's working together for them, on there to help them improve their health and well-being, they'll know that by how, with what ease the employees that they interact with, the staff they interact with, really they know each other, they speak with each other, they do the case management together. We believe that advanced case management and more positions in this area is going to be very instrumental moving forward in the value-based healthcare models. They have to work very closely with, the housing navigators, the social services, and, food scarcity programs. So they have to have all of those resources, and above all, keep in touch with the patient and do that advanced case management, delving into the small details that sometimes, can seem like unsurmountable challenges to the patient, when in essence that, case manager could, really remove those very quickly, or show the patient how to do so that they stay on track with their course of treatment. So those are, plans that we have to increase, and of course, do more of this cross training, continue on with the talent management, make sure that our, salary and pay and benefits are as comparable as possible, and be able to offer, this advanced training, continued education, for our employees as they want to, move up the career ladder. We want to be there to support them.
Thank you, Sarah. And you just read my mind. I was going to ask you about that. Not only in primary care, but anywhere, people are looking for mobility, upward mobility, and you may have someone, who is a new employee, and the person likes what he or she is doing, and she say, no, I would like to make a career. So how do you support, these people who are trying to move on, to improve their careers and their lives?
Well, we've had collaborative agreements with different programs, right, that work with foreign professionals who live in the United States that want to, for example, go back to school, but they don't want to start from the beginning. Remember one through one of our local colleges, it was called Welcome Back program. And so it was great. We were the first site, and we had people that graduated from that program, and always looking, for that, for the provider clinical side, and then for the support staff, as they want to, have upward mobility. They'll, if they say, look, this is what I'm thinking of doing, or they talk to their supervisor, there are resources that we offer. We help them with, the tuition. We're flexible around their hours that they work. Again, wanting to encourage them towards, what their goals are. And then we've also had programs where the accredited agencies will come into our organization and make those classes available. And of course, now they would be virtual anyway. And so it would be like a concerted effort, right? Where we work as the employer for the on-site portion of their experience in, their program, and for their classes, their virtual, and again, making time for them to attend those classes, and making sure that they have the supervision that their program, their accreditation, their accredited program requires, there at the clinic. That's one of the hardest challenges when you go for training programs, certifications, licenses, is to get the supervisory, the person that's going to supervise you, agrees to supervise you, a facility that takes on that additional, exposure for liability. That's all something that you have to be willing to do as an employer. And again, help them with their registration, their books, some of their tuition, whatever you can do to encourage them in their dream.
That's great. Thank you, Sarah. There is I would like to briefly discuss with you this particular issue. I would like to have at least 5 minutes for a Q&A, but there have been different federal organizations, including HHS, the American American Family Physicians Academy, and all these people are talking about the integration of public health and primary care. So how are you preparing for this integration? Like, for instance, in the past, health center didn't need health IT. You know, now health IT is crucial with all this technology that we have. You know, we also have people who are going to be doing research for the health centers. Like, we are moving to gather information about population health, and you need to know how your community is doing compared to other communities. So what strategies are you trying to put in place to make sure that this integration is goes smoothly, and you don't have, you know, to struggle with these changes?
Well, I think, you know, the example you use for population health and research, we've always been very interested in research and studying and using those studies like predictive analytics to help us know real time what is working, what's not, and predict the future, right? So, so we could somehow be prepared for that. We've done many research studies ourselves on on the value of these integrated services from the patient's perspective, and that's also guided our development and our strategies, and knowing, you know, that what patients in our populations really value is feeling aligned with the staff, because that's how the trust develops, and that's how they obtain, you know, the confidence to ask for those resources, and also see somebody who has been in their same situation that has been able to advance and pursue their dreams for career advancement as well. And they ask, but gosh, you came from this similar situation. How did you do it? And can you help me? And where do I go? And what do I need to do? And so it inspires hope as well. And so that's, you know, I think it's all built in part of this whole integrative, compassionate model that works towards the healing and, you know, well-being of patients. It's not just dealing with the issue of today. In terms of the public health, working more with public health departments, I think that's great. I think that, you know, traditionally for a very long time, health centers have been actually performing the work that, you know, we thought traditionally should belong to, you know, public health is public health department, right? But the health centers have really stepped in and provided that, you know, that third sector, if you will, of services where they were needed, and they still are. So we'll see how our public health actually rolls out. What, you know, what support, what role are they going to now redefine themselves as? You know, we've seen health information exchange programs that they're very much part of, and they kind of bring together, you know, the different organizations in the healthcare sector that comprise of, you know, providing the healthcare services for the county's population, for example, or the state. And how are they a repository for certain information, data? How can it be shared? You know, according to obviously all the compliance, regulatory, HIPAA laws, and so forth. And you know, are they going to provide services beyond that as we move forward and see more of this integration you're referring to from the public health sector.
Thank you, Zara. We would like to leave just some minutes for a Q&A session. So if you have a question for our panelist, Zara Marcelian, again, you can type your question, or you can just use the your hand, you can raise your hand and your line will be unmuted. In the meantime, I would like to remind you that after this webinar, there is a survey. Please help us with the survey and complete the survey. It takes just probably a minute, to complete. So your opinion is very, very useful for us to improve our activities. So please feel free to complete the survey after this webinar. So I'm going to stop for a moment and ask Fide, do we have any question for Zara?
Not at the moment.
Okay, and Zara, while we wait for a question, if there is any question, the other question I have for you is, and you and I were talking offline, I guess, about the CHWs and the new opportunity that HHS and HRSA has put together, the training for CHWs. The question is, there will be additional opportunities. This is about the integration that you and I just discussed. So where are you, what is your opinion, on how this integration is going to improve the health outcomes of the population in San Diego?
Well, community health workers really do, since they are familiar, they feel comfortable because they're aligned with the populations that they're interacting with, they're imparting information. And again, they're basically bringing to the directors and operational staff of the health center back that information of how the community interprets their needs and whatever the new situation is or the new health outcome that we are trying to improve. Could be diabetes, asthma, hypertension, so forth. And I believe that community health workers are absolutely essential. They always have been, and we've had different names for them in the past, right? And their role is, again, they will be as impactful as we allow them to be. So if we make sure that they have an opportunity during their work to integrate and interact with the case managers, with the teams, the care teams, to make sure that they have a voice as well from what they're listening to, what they're observing, then we will all benefit from that information, right? And we'll know further how to tailor our delivery and the messages and the outreach and the health education based on their input as well as others. So I think that's going to be a big marker in terms of the outcome and how much can they contribute. It's how much we allow them to, right? Mm-hmm. We're all interested as health centers in, achieving very good grades on our HEDIS measures, right? Our health outcome measures. And it has to do with the quality of care and making sure that, that all of our services have a quality matrix. They're embedded in the delivery of the services and the surveys and the customer feedback. Well, it's all part and parcel of the experience that patients have and how they relay this to the community health workers who basically are there with them, right? From the community into the health center.
Thank you, Sarah. Are there any questions for Sarah?
No.
All right, thank you. Well, we're at the top of the hour. I would like to thank Zara for this conversation. It's always a pleasure to hear from you, all the good things that La Maestra is doing and how you are leading those efforts. And again, please complete the post-evaluation survey. And if you need to contact the National Center for Health and Public Housing, you see our contact information, please feel free to contact us. So thank you again, Zara. Thank you again, those who participated today, and have a great afternoon or good morning if you are in San Diego, California.
That's right. Well, thank you again. It was
All
a
right,
pleasure.
thank you.
Okay. Bye-bye.